Well, we're now going to talk about breakthrough infections. What are breakthrough infections? This is when people get coronavirus after they've got vaccinated by either one or both shots of the vaccine. Experts say while this is happening, and it has been reported here in India as well, it does not mean that the vaccine is not working. In fact, the ICMR is currently doing a study on this, on breakthrough infections. And according to reports so far in the initial stages, they found that the vaccines help reducing the risk of hospitalization significantly. Well, to talk more about this, we're joined by Dr Rachna Kucheria, epidemiologist, and Dr Sameer Gupta, cardiologist, director, Metro Group of Hospitals. Thank you so much, doctors, for joining us. Dr Kucheria, first to you. There have been several reports of breakthrough cases, and it gets discussed on social media, and people get a little worried about this.
Hi, thank you for having me. And I would correct the terminology first. I mean, I don't think we should say breakthrough cases. I think what you're trying to say, or maybe people have raised questions with, is that they got the vaccine and then they still got the COVID infection. Well, a couple of things could be happening. One, and I've had that in many patients as well, that very soon after the vaccination, they've reported actual COVID and it's RT-PCR positive. So couple of possibilities. One, with the high prevalence rates in the community anyway, they could well be incubating the virus while they went on to get the vaccine. That's one possibility. The other is that, while they were waiting the half an hour or what have you to go, be in the center and masks were not proper, they could have got infected by other people who are asymptomatic or in early stages of the disease. So yes, infections are happening in people who've had the vaccine, even one dose or two, but mostly they are not reaching the hospital and they are not severe. I also look forward to the Indian data. We have data from the UK already that after their second wave, they've collected a large number of data that, those who did have the vaccine, the hospitalizations were almost nil. So the vaccine endpoint, I've said this before, was never to prevent infection. The vaccine endpoints are to prevent severe disease and hospitalization. And while we look at our own data, I think the clinical experience for most of us has been that that part is happening.
All right. Dr. Gupta, what has your experience been among patients? And also what happens if people are asymptomatic, as Dr. Kucheria said, and this could, of course, given that, the high extent of the spread of coronavirus in our community, that a lot of people who are asymptomatic are going ahead and getting the vaccine.
I would like to echo what Dr. Kucheria said regarding the infection. We are seeing, I personally know of at least more than 20 people who have gotten COVID after either the first or second dose, a lot of them after the second dose too. And like she said, either they were harboring the infection before they got the vaccination, or they picked up the vaccine, they picked up the infection at the time of vaccination. They went to a community setting where there were a lot of people, and they picked up the infection. But we do know, and what we are seeing is that that people who are getting COVID after the infection usually are getting it a mild to moderate and not a very, very severe infection which requires ICU level of care. And that is what the goal of the vaccination is, right? I mean, we give vaccine not just to prevent infection, we also give it to reduce the severity of the infection if the infection is to happen. And in none of these people whom I know or whom I've treated or seen who have gotten COVID after both doses or a single dose of vaccination are people who have gotten acutely sick, requiring BiPAP or ventilator. They have gotten mild to moderate COVID and have recovered. So that is, I think the vaccination is doing its job in reducing the severity of infection compared to those people who don't have any immunity at all whatsoever. So I think vaccination is the right thing to do, and it is important that we as a country ramp up our immunization process and vaccination process, because that is one of the only ways we will be able to fight the infection and end the pandemic.
Right. Dr. Kucheria, also, one of the doctors I'd spoken to earlier pointed out how people need to know that the vaccine is not a cure if they have COVID. What's happening, he was saying, and he's heard reports, is that people, are mildly sick and they think, oh, let me just quickly go and get vaccinated. And they, again, as you said, are probably harboring, the infection, and they go ahead and get vaccinated because they think that somehow it's going to protect them from getting ill.
Wow. I must admit that this is the first I've heard of it, but you obviously get to hear so many more things
This was from
Bengaluru.
This was a doctor from Bengaluru who said this.
And absolutely not. I mean, if you have mild symptoms, this is what we're saying at this point. If you have mild symptoms, a cough, fever, just body aches, even just an unknown tiredness, please consider this COVID, isolate and do nothing more. You can go ahead and get a test, and that I know right now practically is very difficult in most cities for somebody to come and do a home collection, and the reports may take 3 or 4 days. Please don't step outside your room even and go around infecting other people. At this time, this cluster of symptoms is COVID until proved otherwise. So, cut the transmission, help us. And unfortunately, I'm still seeing patients where they've had these symptoms for 7-8 days and they're not isolating. So this message really needs to be clear. Fever, cough, body ache, headache, just a little bit of dryness here in the throat. Isolate, wait it out, consult somebody, wait for a test, but don't go ahead infecting. It's a small inconvenience to isolate yourself versus going ahead and infecting the rest of your family or community outside.
Right, absolutely. And, as you were saying, we need a definitive study on this. Dr. Gupta, it would be great to see, maybe a few months down the line, how many of such breakthrough infections, as they're called, are really reported, and how many of them actually need hospitalization or lead to a serious illness.
Yeah, I think this is data that we are all looking forward to seeing. I know there's been a lot of speculation about one vaccination over the other, about new strains coming out,
yes,
about seeing if the serum from those people who are immunized versus one of the variants, the second variant. And the data so far has been fairly promising, where in some of these vaccinations, whether it's the Pfizer vaccine or the Covaxin, there has been negation of the virus of different strains. But this is data that we're all looking very closely at, because as the pandemic evolves, we will see new strains coming up. Some of these strains may be milder and some of them may be more. So I think we're all looking forward to this data, trying to see how we can end this and fight this together.
Right, especially as we have more variants also being reported and, the gathering speed across the country. Well, with that, we'll slip into a short break, but return with our viewer question segment. So do call in on that number on your screens if you have any questions for the doctors. Stay with us. Welcome back. You're watching our special show, Coronavirus Facts versus Myths, and we have doctors with us to answer all questions that you may have. And let's just get our first caller, Vishnu from Thanjavur, from Tamil Nadu, calling in. Go ahead with your question.
Yeah, good afternoon, ma'am. I have this question regarding this coronavirus vaccine. How long we can delay the second dose of vaccine? Can we do like after 6 months or 8 months? So what is the most extended time? I need to know that.
All right, Dr. Kucheria, to you.
Yes. So with Covaxin, the guideline is 1 month for the second dose is the gap. And with Covishield, you can take it anytime from 4 weeks up to 8 weeks. I think they've extended Government of India to 6 to 8 weeks. But studies overseas with this same vaccine have said that it works even after 12 weeks, but certainly not 6 to 8 months. No, please don't go over, I would say at this point, 8 to 10 weeks.
All right, Dr. Gupta, this seems to be a big worry right now, especially because we don't seem to have enough doses of the vaccine. Those people who have, are due for their second dose of the vaccine are getting quite agitated given, the lack of doses.
Yeah, this is something which is certainly real, that, the vaccinations are not currently as free-flowing as they were maybe a couple of months ago. And people, I'm also getting inundated with requests, and I'm sure Dr. Rachna over here is also getting the same, where, people are reaching out and asking, where can I get the second dose? But you know what, if you've gotten at least one dose, there is some immunity in your body. There is something which is going on. And we saw from the data from the trial that one dose gives you upwards of 70% immunity. So, even if you take that, now how long that 70% immunity lasts is a matter of debate. But at least you've got something going on in your body. And, we'll take that. And as the vaccinations become more available, it would be time. I foresee a big rush, not just of 18 to 45-year-old, but also people who've gotten one dose and now want the second dose. So that rush is also going to be there, because they're all going to be due for the second dose. So I think we have to wait and see when the vaccinations come and become free-flowing. But, this is certainly something which is real. But you know what? Like I said, at least one is better than none.
All right, we have a caller from Toronto, Venkat, calling from Toronto. Go ahead with your question.
Hi,
Hi, very good afternoon. I have my father diagnosed COVID positive. So today is the seventh day of day 7 for since his first symptoms. So his age is 62, and he has comorbid conditions of diabetes and psoriasis, rheumatoid arthritis, a couple of these conditions. So basically, I wanted to know how frequently we should be running the blood inflammatory marker test for him.
Okay, Dr. Kucheria?
Yeah, sure. Again, I would suggest not getting into this loop of running the inflammatory markers. The first most important thing is the patient's clinical condition. How are they feeling? What are their symptoms? Are they short of breath at home? What is the fever? What is the oxygen level? All of this will give you enough indication as to the patient's condition, and we categorize them as mild, moderate, and severe. And really, if the test should only be done with the prescription of a physician, with the suggestion of a physician, who is then willing to follow up on these tests. Many times I get patients having got them done before, or some family person has got them done, or a family physician told them to get them done. And then you're stuck with labs that you didn't order and didn't need, and then there are no answers for that. Labs, these should be done only in conjunction with the patient's clinical condition, and as I said, ordered by the physician. So that's the big caution that I would like people to take away from this. They can cause more harm if you do labs unnecessarily than benefit your patient.
All right. We have a tweet question in from Vignesh. He asks, almost all COVID deaths I'm hearing about in my close circles are due to heart attacks. So how can infected patients watch out for any signs? Are anticoagulants, blood thinners of any preventive type? Should these only be administered to patients with severe symptoms? Dr. Gupta, to you that question.
So that's a great point. So I'm a cardiologist, so this is a question which is right up my alley regarding COVID and heart disease. And COVID definitely does involve the heart in various ways. We are seeing, we are seeing arrhythmias, which is irregular heart rates, in irregular heart rhythm in people with COVID. We are seeing a lot of some cardiomyopathy. Cardiomyopathy is affection of muscles of the heart in patients who've got COVID. This is usually seen in people who've got moderate to severe COVID, and we can diagnose it with an echocardiogram, which is an ultrasound of the heart. What COVID does is it makes your blood thicken. So that is where the thing of blood clots come in, and these blood clots can go in different parts of your body and cause different problems. And I've seen quite a few cases of that. And that is why we give you blood thinners. Now, these blood thinners are not to be taken for everyone. They're not something which you go and pick up over the counter. They're fairly strong medicines, and they have to be dispensed on a case-by-case basis. Now, cardiac arrest is something which basically means your heart goes into a funny rhythm, or your heart stops beating altogether. And this is not just a manifestation of COVID. It is also seen in if you get really sick with some other diseases, your heart basically goes into a funny, irreversible rhythm, causing a cardiac arrest. And this is not a reflection of COVID on the heart directly, but is an indirect effect of everything else which is going on in the body. All the inflammation, all the electrolyte abnormalities, the low oxygen. So all these things can precipitate cardiac arrest, and that is usually how a lot of people die. And so when does a person die? He dies when his heart stops beating, or usually most people before they die, they have a cardiac arrest of sorts. And this is not just with COVID, it's with most diseases.
All right. We have another tweet question. Can lung fibrosis patients take the vaccine, and any specific precautions to be taken by such high-risk patients apart from the nebulization, oxygen supplement, etc.? Dr. Kucheria?
Well, as far as the contraindications listed for the vaccine, this is not one of them. But lung fibrosis patients are in a severe category. I'm sure these patients would have a pulmonologist involved in their care. So I would suggest that they take the advice of the pulmonologist before getting the vaccination, and which kind, all of that, because they are on sometimes suppressant drugs and all of that. So this has to be done case by case, and I wouldn't like to give a blanket answer here.
All right. Important point there to really consult, the doctor who's doing the treatment. Well, thank you so much, doctors, for taking out time and answering all those questions and all those doubts that people have. Thank you for joining us today.